can start.
Okay, ready? We're going?
Going.
All right, so we've been spending a tremendous amount of time going through the different possibilities and everything that's going on with the current healthcare crisis that everyone is talking about and that is happening to our community. The first and foremost thing is that we want to make sure that everybody is taken care of and that all safety precautions are met. And so what we've found through our research, that we've been working around the clock and just staying up on everything, is that these things are changing so fast, we're trying to wait for some stability. But at this point, we're just going to take those precautionary measures because at this point there's not enough information and not enough data has been gathered to know of the severity or the potential of anything to happen. And we've seen some cases where there has been some recklessness that has caused some issues. So we're going to approach it with caution right now, and we also recognize that kids need to be able to have recreation and kids need to be able to live and be out and do things and be with friends and things like that. So there's a fine line here between living and sort of sequestering ourselves. But right now, I think that the main thing is safety first. Methods of getting kids in there in small numbers and doing training and online videos and different things like that. We're going to be bringing in a flat screen TV into the facility that'll be wall mounted so that we'll be able to administer drills and skills and those things to players that are in the gym, and also so that I can do live tutorials globally for our players, not only here in our community, but in other communities around the world that we're working with. So it's a fast change and we don't know what's going to be on the horizon, but we're working around the clock to make it happen. So we're ready to pivot in 3 ways. We're ready to pivot and run a full entire academy at our location, at our facility at the Eyeball Sports Complex, with minimal numbers on rotation. That's up to any health code or standards that they're going to regulate or potential regulations that we will make sure that we adhere to. So we're excited about it, excited to be able to be in a situation where we can try to provide an opportunity from the private sector, and we'll see what that looks like here as the landscape is ever moving.